Bismillahirrahmanirrahim. My topic for today is no thief, however skillful, can rob one of knowledge, and that is why knowledge is the best and safest treasure to acquire. My name is Dr. Ida Shahram Sarwar, and under supervision of Dr. Saira Afzal, my topic for today is epidemiology, which is basically estimating the potential for prevention. Our learning outlines are introduction, definitions of epidemiology and prevention. There's basically three types of prevention, approaches to all three levels, and strategy for prevention, along with MCQs. And our learning outcome will be that at the end of the presentation, participants will be able to define all three levels of prevention with detailed insight to approaches to each of them, their methods, and their importance in curbing and preventing diseases. What is epidemiology? Epidemiology is basically the study of how disease is distributed in populations and the factors that influence or determine this distribution. Why does the disease develop in some people and not in others? The premise underlying epidemiology is that a disease, illness, and ill health are not randomly distributed in human population. What is the definition of prevention? Prevention is basically defined as actions aimed at eradicating, eliminating, or minimizing the impact of disease and disability. The concept of prevention is best defined in terms of context of levels traditionally called primary, secondary, and tertiary prevention. Epidemiology and prevention. A major use of epidemiological evidence is to identify subgroups in the population who are at high risk for disease. Why should we identify such high risk groups? Firstly, if we can identify these high risk groups, we can direct preventative efforts such as screening programs for early disease detection to populations who are most likely to benefit from any interventions that are developed for the disease. Secondly, if we can identify such groups, we may be able to identify the risk factors or characteristics that put them at high risk and then try to modify those factors. It is important to keep in mind that such risk factors may be of two types. Characteristics such as age, sex, race, for example, are not modifiable, although they may permit us to identify high-risk groups. On the other hand, characteristics such as obesity, diet, and other lifestyle factors may be potentially modifiable and may thus provide an opportunity to develop and introduce new prevention programs aimed at reducing or changing specific exposures or risk factors. In discussing prevention, it is helpful to distinguish amongst the different levels, which include primary, secondary, and tertiary prevention. Primary prevention basically denotes an action taken to prevent the development of a disease in a person who is well and does not yet have the disease in question. For example, we can immunize a person against certain diseases so that the disease never develops, or if a disease is environmentally induced, we can prevent a person's exposure to the environmental factor involved in thereby preventing the development of disease. Primary prevention is basically our ultimate goal. Secondary prevention involves identifying people in whom a disease has already begun, but who have not yet developed the clinical signs and symptoms of the illness. This period in the natural history of a disease is basically called the clinical phase of the illness. Once a person starts developing clinical signs or symptoms, it is assumed the person will seek medical care. Our objective with secondary prevention is to detect the disease earlier than it would have been detected with usual care. And tertiary prevention basically denotes preventing complications in those who have already developed signs and symptoms of an illness and have been diagnosed, that is, people who are in the clinical phase of their illness. This is generally achieved through prompt and appropriate treatment of the illness combined with ancillary approaches such as physical therapy that are designed to prevent complications such as joint contractures. To sum it up, primary prevention basically involves preventing the initial development of a disease through use of immunization, which would reduce the exposure to a risk factor. Secondary prevention involves early detection of existing disease to reduce severity and complication, which is, for example, in screening for cancers. And tertiary prevention involves reducing the impact of the disease. And an example of this would be rehabilitation for stroke. Levels of prevention include the primordial prevention, in which the whole population, which is going to be involved through public health policy, which means to basically establish or maintain conditions to minimize hazards to health, and this also basically involves advocacy for social change to make physical activity easier. In primary prevention, the whole population and selected groups and individuals which are basically healthy are going to be involved, and primary prevention basically helps prevent disease before it develops and involves reducing risk factors. And it also includes primary care advice as part of routine consultation. Secondary prevention basically involves and includes the patients who are basically at high risk are going to be selected. This includes early detection of diseases through screening and intervention, example in pre-diabetics, and primary care risk factors are going to be reduced at risk of chronic disease, falls, and injury. Tertiary prevention involves just patients, which helps to basically treat established disease to prevent deterioration. And an example of this would be exercise advice as part of cardiac rehabilitation. Primordial prevention is basically defined as prevention of risk factors themselves, beginning with change in social and environmental conditions in which these factors are observed to develop and continue for high-risk children, adolescents, and young adults. It is the prevention of emergence or development of risk factors in countries or population groups in which they have not yet appeared. The main intervention in primordial prevention is through individual and mass education. Examples of these would include national policies and programs on nutrition involving the agricultural sector, food industry and food import-export sector, comprehensive policies to discourage smoking, programs to promote a regular physical activity, and making major lifestyle changes. Primary prevention can be defined as actions taken prior to the onset of the disease, which removes the possibility that the disease will ever occur. Signifies the intervention in pre-pathogenesis phase of a disease or health problem and can be accomplished with measures of health promotion and specific protection. It includes the concept of positive health, a concept that encourages achievement and maintenance of an acceptable level of health that will enable every individual to lead a socially and economically productive life. Primary prevention may be accomplished by measures designed to promote general health and well being and quality of life of people or by specific protective measures. It is achieved through health promotion, which includes health education, environmental modification, nutritional interventions, lifestyle and behavioral changes, and specific protection, which includes immunization and seroprophylaxis, use of specific nutrients or supplementations, protection against occupational hazards, safety of drug and foods, and control of environmental hazards. Example, air pollution. The WHO has recommended the following approaches for primary prevention of chronic disease where the risk factors are established. This includes a population mass strategy and a high risk strategy. Population mass strategy is directed at the whole population irrespective of individual risk levels. For example, studies have shown that even a small reduction in the average blood pressure, serum cholesterol of a population would produce a large reduction in the incidence of cardiovascular disease. The population approach is directed towards socioeconomic, behavioral, and lifestyle changes, whereas the high risk strategy basically aims to bring preventative care to individuals at special risk. This requires detection of individuals at high risk by the optimum use of clinical methods. Secondary prevention is basically defined as the action which halts the progress of disease at its incipient stage and prevents complications. The specific interventions are early diagnosis, which are achieved through screening tests, breast self examinations, for example, mammography in women 50 years and older, pap smear tests, radiographic examinations, case finding programs, etc., as well as adequate treatment. Secondary prevention attempts to arrest the disease process, restore health by seeking out unrecognized disease, and treat it before irreversible pathological changes take place, and reverse communicability of infectious diseases. It thus protects others in the community from acquiring the infection and thus provides at once secondary prevention for the infected ones and primary prevention for the potential contacts. WHO Expert Committee in 1973 defined early detection of health disorders as the detection of disturbances of homeostatic and compensatory mechanisms while biochemical, morphological, and functional changes are still reversible. The earlier the disease is diagnosed and treated, the better it is for the prognosis of the case and in the prevention of the occurrence of secondary cases. Tertiary prevention is basically when the disease process has advanced beyond its early stages. It is defined as all measures available to reduce or limit impairments and disabilities and to promote patients' adjustment to irremediable conditions. Intervention that should be accomplished in the stage of tertiary prevention include disability limitation and rehabilitation. Disability limitation, basically this flowchart goes in the following way, that it begins with disease, then it goes on to impairment, disability is, and then handicap. Impairment is basically defined as any loss of or abnormality of psychological, physiological, or anatomical structure or function. Disability, on the other hand, is any restriction or lack of ability to perform an activity in the manner or in the range which is considered normal for a human being. Handicapped is defined as the advantage for a given individual resulting from an impairment or disability that limits or even prevents the fulfillment of a role in the community that is normal, depending on age, sex, and social and cultural factors for that individual. Rehabilitation is basically the combined and coordinated use of medical, social, educational, and vocational measures for the training and retraining the individual to the highest possible level of functional ability. It involves the following types, which include medical rehabilitation, vocational rehabilitation, social rehabilitation, and psychological rehabilitation. The types of in medical rehabilitation, it basically involves the restoration of bodily function. Vocational rehabilitation involves the restoration of the capacity to earn a livelihood. Social rehabilitation involves the restoration of family and social relationships. And psychological rehabilitation involves the restoration of personal dignity and confidence. Strategies for prevention basically begin with assessing the exposure, identifying populations at high risk based on demography, family history, as well as certain host factors. Conduct research on mechanisms, including the study of genetic susceptibility. Apply population-based intervention programs. Evaluate intervention programs and modifying existing intervention programs. Now with MCQs. Question number 1. The purpose of which is to limit the incidence of disease by controlling causes and risk factors, and the options for this include primordial prevention, primary prevention, secondary prevention, or is this tertiary prevention?
A.
It's B, primary prevention. Question number 2. Mammography should be usually done in women annually in what age groups? Option number A, 50 years and above. Option number B, 60 years and above. Option C, 45 years and above. Option D, 30 years and above.
D. Delta.
45 and above.
It's A, 50 years and above. Question number 3. Public policies in Pakistan aim at avoiding the underlying reasons for the development of environmental and atmospheric concentration of sulfur dioxide to protect the health of the people. This is an example of primordial, primary, secondary, or tertiary prevention.
Beta.
This is an example of primordial prevention.
A.
Yes. Question number 4. Prevent neonatal tetanus by tetanus toxoid injections during pregnancy is an example of primordial prevention, primary prevention, secondary prevention, or disability limitation.
Secondary
prevention.
C.
Yes, it's beta.
Primary prevention.
Question number 5. Which of the following is the most logical sequence? A, impairment, disease, disability, handicap. B, which is disease, impairment, disability, handicap. Or C, which is disease, impairment, handicap, disability. Or D, which is disease, handicap, impairment, disability.
B.
Alpha.
It's B. Question number 6. If a child presents with protein energy malnutrition showing signs of loss of subcutaneous fat and weight reduction, the level of prevention suggested at this point is A. Primordial prevention. B. Early diagnosis and prompt treatment. C. Specific protection. Or D. Disability limitation and rehabilitation.
Beta.
No, it's
B.
all.
B.
It's delta. Question number 7. Wearing a crash helmet to prevent head injury while riding a motorcycle refers to specific protection, health promotion, rehabilitation, or early diagnosis and prompt treatment.
B. Health promotion.
Health promotion.
It's B.
Yeah.
It's B. Question number 8. The policy of delaying marriage of girls till 20 years of age belongs to which level of prevention? A. Primordial prevention. B. Primary prevention. C. Secondary prevention. Or D. Disability limitation.
Primordial prevention.
Primordial.
It's A, yes. Question number 9. A pap smear and colposcopy examination for the early detection of cervical cancer and papilloma virus infection constitutes A. Primary prevention, beta secondary prevention, C. Tertiary prevention, or D. Surgical treatment.
Primary
prevention.
prevention.
No, it's secondary prevention because that's used for screening of cancers. Question number 10. A 55-year-old hypertensive patient admitted in the medical ward with cerebral stroke, which after treatment he recovered but was unable to move his right lower limb. He was advised to do physiotherapy, and this type of assistance comes under A. Health promotion, B. Specific protection, C. Prompt treatment, or D. Rehab.
Rehab.
It's D. This is the key. And these are my references.
Okay, thank you very much, Dr. Rida. I think you have completed your presentation.
Yes, ma'am.
Right. So, in the end, you also have to present the YouTube channel where you are going to upload your presentation after each presentation and discussion. Today, it is a very good presentation and the very important concepts have been presented very well. However, there are a few points that can be added to increase the quality of this presentation. If you please go to your MCQ number 2. So here we are. Mammography should be done annually in women of what age? Now, there are different recommendations from the different guidelines as well as from different countries. Now, we are referring to certain guideline and it should be based on certain scenario because the mammography, whenever it is advised, it is depending upon the age and further risk factors like family history, if there is any history of a lump or some other thing, then the age would be much lower than 50 years. If we go for the US, yes, the age that is recommended is 50 to 74 years. However, when we go to other guidelines, we find that it depends upon the culture as well as the country where the guidelines are being made and how the evidence is giving the data of having the breast cancer. We know in Pakistan, the breast cancer usually they are presenting in much lower age and there are certain factors for it. If someone has the family history or has any lump or is having the very strong suspicion of having breast cancer, then they have to go for mammography even in the younger age. So this scenario, it is not fully explaining that what are the different conditions and what are the different guidelines where it is referring to. So it has to be reframed with the addition of the further information and also referring to the guidelines. Either we are asking for the guidelines from US, from CDC, or from Pakistan, or from United Kingdom, etc. Another important thing is that please go to your recent advances, please.
Ma'am, which slide are you talking about?
Yes, you have not presented the recent advances, and we have a very important format that the recent advances on that topic must be presented. Whenever
Okay.
we are talking about different types of prevention, we always look into the literature that how the people around the world, they are working and producing the latest findings in that direction. For example, if you are talking about the primordial prevention, what is the latest literature that is available in 2022, 2021, and in 20. So in past 3 years, you have to look for the recent advances. And if you have one historic reference, then it is a wonderful thing to go forward. So in recent advances, you have to look for the past 3 years for the current practices and literature review, and what else is present in literature that was not present previously. So
Okay,
this
ma'am.
is something that is missing from these slides. And at least you should give 3 to 4 important recent advances in your each presentation,
Okay, ma'am.
right? Okay, thank you very much. Overall, it is a very good presentation. If you please go to your MCQ number 6. Now, this is the type of scenario that we are always looking for, that you have given a child that presents with a protein energy malnutrition showing signs of loss of subcutaneous fat and weight reduction. The level of prevention suggested at this point is, now this is the scenario that has sufficient information. We can think and even we can imagine a child. If you can put a picture in such an MCQ, that would further help us to find out that there is a child who is malnourished, and there are the signs, because the signs can also be seen by the doctors, and these signs can be presented very beautifully in figures as well as in pictures. So if you can insert one of the figure or picture in this MCQ, this is giving us sufficient information.
Okay, ma'am.
Thank you very much. Overall, it is a good presentation, and you can update it and share in the group.
Okay,
Please
ma'am.
also upload this presentation on the YouTube channel so that the other students can also get benefit of it. Thank you very much.
Thank you, ma'am.
Allah Hafiz.
That's it.
Love is